Is it clear? So those are the different elements that need to be done for ischemic and hemorrhagic stroke when you want to relieve the symptom by treating the mechanism of the disease. Now, by using the principle of management. Now, they said the next thing that you have to evaluate now is to treat the cause. Is it clear? Is to treat the cause. Now, similarly, I've said the cause can be divided into ischemic and can also be divided into hemorrhagic. Is it clear? So those are the two elements of the cause. Now, in ischemic stroke, the cause can be atherosclerotic. Is it clear? Atherosclerotic. Now, after already having removed the first part, so you have to when you have already stopped the dying, you have treated the diagnosis and the complication, you can treat the cause. So for atherosclerotic, is it clear? To manage that atherosclerosis, generally I've told you that the atherosclerosis can occur at the level of the coronary artery. So you have done the carotid Doppler and you have found that there is plaque at the level of the carotid Doppler. You need to do management with interventional, that is surgery, where you are going to do a carotid endarterectomy. Is it clear? So you do carotid endarterectomy in order to scrape out the plaques that are going to be located. But now when you do carotid endarterectomy, it can be a risk factor again for another stroke. Is it clear? Because it can dislodge the plaque. Now that is for atherosclerosis. Now the next one now, where you have also another cause which can be cardioembolic. Is it clear? So you need to find the reason why there is that embolus. Is it clear? So when you want to treat cardioembolic, you need to first give the patient anticoagulants. Is it clear? To prevent blood clot formation. So you give anticoagulants like heparin, warfarins. Is it clear? And then you give other antithrombotics like antiplatelet to prevent platelet aggregation. Is it clear? So you give antiplatelets. So you give anticoagulants like heparin, rivaroxaban, and you also give even antivitamin K depending on your choice and to prevent side effects. And we also give antiplatelets for cardioembolic to prevent the thrombus formation. Now, cardioembolic is made up of two elements. It's made up of first embolic, which is thromboembolic, where you give this anticoagulant, and it's made up of cardio. The word cardio comes here because there are certain etiologies that can be associated with ischemic stroke, particularly when you have an arrhythmia. Is it clear? So you need to treat the arrhythmia of the patient by using an anti-arrhythmic medication. Is it clear? If it is a tachyarrhythmia, you are going to use a beta blocker and an anti-arrhythmic. Beta blocker is in such a way that the rate should be normalized. But if the rate is already normalized, there is no need to use a rate control medication. Rate control medication is only used when you have an abnormal rate. But in this case, if the patient does not have an abnormal rate, don't use a rate control medication. Example of rate control medication, you can have beta blockers and you can have digoxin, digitalis, which are rate control medication. Digitalis are also positive iotropic medication. Is it clear? Now, if the patient has also another problem, anticoagulants also come in place in order for anticoagulation. If the patient has a rhythm disorder, is it clear? An arrhythmia, is it clear? Now you need to give an anti-arrhythmic medication by using a pharmacologic by using a pharmacologic cardioversion. Is it clear? The anti-arrhythmic medication are divided into three classes. You have class 1 to class 4. Class 1 is a sodium ion channel blocker. Example, you have flecainide, you have lidocaine. Class 2 is a beta blocker. Is it clear? Class 2 is beta blocker. Example, bisoprolol, carvedilol. Class 3 is a potassium ion channel blocker. Example, amiodarone. And then class 4 is going to be a calcium ion channel blocker. The dihydropyridine calcium ion channel blocker. Example is verapamil. Is it clear? So those are the different elements that you need to evaluate in a patient that has a stroke. Is it clear? So you need to also give anti-arrhythmic to treat for the cardiac disorders. Now the next thing after giving the anti-arrhythmics, so you need to give the anti-arrhythmic after treating. So for cardioembolic, we have also for lacunar infarct. Lacunar infarct, we say that it is mostly due to a lipohyalinosis. Is it clear? Any medication that can result to lipoamyloidosis. You have a problem with HIV, or you can use antiretroviral medication can result to a lipoamyloidosis. Is it clear? So a particular antiretroviral may be stopped, and you also need to give medication that are going to reduce the triglyceride level of blood. Is it clear? So generally those are the different elements. Now the next one now is for hemorrhagic. In hemorrhagic, the cause may be aneurysms. Is it clear? And when you have aneurysm, you need to do interventional methods. Interventional methods where you are going to do stripping, aneurysmal stripping. Is it clear? You are going, or you do aneurysmal nipping. Is it clear? Meaning that when you close the aneurysm surgically or interventional radiology. Is it clear? You need to close that aneurysm so that it should not rupture in another circumstance. Is it clear? Or if you have arteriovenous malformation surgery in order to nip or strip the aneurysm. So we have aneurysmal nipping in order to close the. Is it clear? Or coiling. You can have also other terms like coiling. Is it clear? So those are the different things that you need to do for hemorrhagic stroke in order to treat the origin. Now the next element is to prevent the reoccurrence. So when you want to prevent the reoccurrence of stroke, is it clear? Generally you need to evaluate for the background of stroke. Is it clear? So based on the risk factor that the patient had. Is it clear? And we said that the risk factor of stroke, we have set multiple risk factors that I'm going to show you now. So these are the different risk factors. We said that for atherosclerotic stroke, you have traditional and you have novel risk factor. For the traditional risk factor, you have modifiable, non-modifiable. Is it clear? Now under the modifiable, you need to know if the patient has hypertension, you need to do the hypertensive workup of the patient as investigation, and you also need to do what it is